Hey, and welcome back to Raven Wing Farms. Today I want to talk to you about my Tasmanian Tiger medical bag, some of the things on the outside, some of the things on the inside, and why. Stick around. Beginning with the items on the outside, first thing I have is a admin. Okay, in that admin I just have a pen light, Sharpie, a notepad, gloves ready to go. We'll talk more about that later. Got gloves staged and ready to go pretty much throughout the pack. And then also some procedures and then the march orders in case you forget, you get under stress, you get shaky. If you have to do something, a procedure that you've done in training but you haven't done it in years, it may be going over that. So I keep a copy of that as well. And all that is on the admin. And then also a notebook in case you need to make notes, certain things. And it's always helpful. And a pencil, of course. And then moving up here, just have a set of shears, tactical shears. Those are, I said tactical shears, didn't I? I didn't want to say that. What they are, they're EMT shears. All right, all they do is they cut away clothing and then some of the heavier seat belts, things like that. And then also I have a beacon. This is a night core, 4 lights. This beacon can be useful at night if you're trying to locate, or if you're trying to mark an accident site or whatever. It's good to do that. It's always nice to have around. It stays on your pack, and then it can also be magnetic, so you can put it up on a piece of a car or something like that. On the outside, talking about what you would need to get to save lives, all right? If there's an accident and you have massive hemorrhaging, chances are you're gonna have 2 types. You're gonna have appendage and then joint, okay? If you have an appendage wound, you're gonna be able to stop that most likely with tourniquets. So I have 2 of those. I don't have to open the bag at all. I can immediately get to 2 of those. I use quality tourniquets, don't use the cheap ones. There's countless stuff out there about why you wouldn't want to use the cheap ones. For the tourniquets, just get the North American Rescue or better, all right? Have 2 of them, have them staged, ready to go, so you're not fumbling around trying to loop something or trying to thread it. It's all ready to go. Know how to use it. Again, go to a class. They'll teach you these things. All right, so I have 2 of those. Also have here a Benchmade rescue hook. Okay, really this is just good for cutting seat belts and straps. And then as a sort of a redundancy thing, going back to the admin pouch, I have a set of Leatherman Raptors. These are really good, obviously, for cutting away clothing, things of that nature. But they do have, in case you have to break glass, there is a glass break on the back. And then also, there is another strap cutter or a seatbelt cutter. So these are a good thing to have on hand, obviously. So, if we can get them back together or not. Hey, you're getting this live, man. I'm not a pro. That's probably obvious at this point. All right, moving on. Getting this back in here. The bag itself, okay? Now, I want to talk about something else I forgot about was a locator bag, okay? If life flight on an accident or something like that is coming in and you're trying to make it visible for them, this does have a roll-out marker panel, and that's really useful. And that rolls out, and then it's bungees. You can bungee to the handle, and it stows up in here in the back underneath. All right. Now, I've heard some criticism on this bag. By the way, it does have some straps. These straps do come off. They're able to stow, and you can strap these to another bag, either to if you're wearing plate armor, you're in the military, or law enforcement, you can strap this to that. But then also, there are 2 handles that at first, I kind of didn't understand, but it makes sense once you start, once you just start loading the bag. If you're moving, now, I can do that with the bag closed. But if this bag is open, which is, it's about to be, you can scoop these up, still the arms free, and bring the bag with you while you're going to another casualty or another accident victim, whatever the case may be. Okay, time for a camera angle change so that you can see what's in here. Give me a second, be right back. Onward into the inside of the bag. Okay, first of all, let's zip it open. Now, talking about these handles, it'll become apparent if you're working on an injury or casualty and you need to get off the X, or if you need to run to your paintball squad who just got taken out by paintball claymores and treat some boo-boos, you scoop it up, boom, ready to go, okay? So you're not relying on this one handle, stuff's falling out all over the place. Anyway, okay, that's out of the way. Now let's talk about how it's compartmentalized. This is where this thing is really, really useful. I think it's pretty cool. Okay, it's got plenty of space. I'm just gonna go, I guess, left to right. And on here, I just have some gauze, some H&H. It's not compressed, it's just roll gauze. Some 3M self-adhering, and then also some, now I'm drawing a blank. It's the wraps with the sports wraps. Good Lord, man. And then not only that, some tape, medical tape, 2.5 inch, 3 inch roll, some battle wrap, and again, if you need to get straight to treating a certain kind of an injury and you can't get to a glove, got a set of gloves prepped right here, you can pull it out. Now, I also have various other bandages stuck around here just to make myself look cool and the pack look cool, if you will. Second thing I have, let's talk about these rip out bags. Now, let me back up a little bit. This can rip out, all right? And you can put anything, you can put snacks, you can put Skittles in it, anything you want to put in it. Works out fine. Now this, a little bit thinner, and then also this is a bit thinner than this side, and that affects it because you can't put as much on this side as you can this. This little doodad here, again, it came with, what I liked about it, it came with white marker tapes. You can mark on it, put what's in it, and then you're not struggling or you're not trying to go, crap, I need to find X. If you forget, and if you've ever been under stress, if you've ever had to do something really important, chances are you can forget stuff. So if you make it easier on yourself or somebody else who might need to use this kit and you necessarily haven't shown them what's where, this makes it easier, okay? Inside this, I just have eye shields, safety pins, an emergency blanket, some surgical tools, not a lot, mainly some arterial clamps, tweezers, and then a scalpel, and then more gloves, and then extra bandages. This one, talk about color coding too, something else I've kind of left out. Blue, red, and white. White is just, hey, what's in what? Maybe not as important under duress. Obviously, massive hemorrhaging is the first thing that you want to take care of. If you can't stop it with the 2 external tourniquets and you need to go deeper, if it's a junction wound, first thing you'll see here, I can rip that out, toss that to somebody, use it myself. The first thing I'm pulling out after I've put on my gloves, you've got quick clot combat gauze. Now, a word about the combat gauze. It does have an agent that has a clotting agent. It does work, but it doesn't do any better than regular compressed gauze, meaning it just takes longer. Regular compressed gauze will take longer to stop bleeding, and you'll have to hold pressure for 30 minutes or more, whereas this is typically 10 to 15 minutes. If you've packed it right, held your pressure, and then put an Izzy bandage on top of that, an Israeli bandage, it should stop most junction wounds and hemorrhaging in 15 minutes or so. Okay, I've got that in here. And then also, I have a complete resupply IFAK. And what that is just a North American Rescue supply, ready to go, unsealed, or rather unopened, in case I need that. I have chest seals. I have 2 extra tourniquets. Okay, these are prepped, but you kind of gotta, these are just extra in case something else comes up and you run out. I mean, there are 4 appendages, so you could need four hemorrhage, or you could need 4 tourniquets, right? Right, okay. And then also I have a couple of sizes of Israeli bandages. I have a 6 inch and a 4 inch in here. I'll put it back together here because you don't need to reassemble all this because it takes time. All right, that's your massive hemorrhaging. Second is your airway, okay? You need to have to check to make sure that your casualty is breathing. There are ways to do that. Again, I can't stress this enough. Don't just watch YouTube videos. Don't just read your first aid manual and think, hey, I got it. No, go to a class, invest in yourself. Look, you probably have $1,000 guns, buku ammunition, and at least 8 cases of MREs. Go get some training. Do that, because that really, really matters. And when you do that, all of these things click. When you've taken and stuffed a dummy, when you've been shown by a professional how to put on a tourniquet, how to reassess a tourniquet, how to really see if one is needed, when to take one off and when not to ever take one off, all that comes into play. Go get the training. You'll probably hear me say that at least 5 more times before this is over with. On to airways. Okay, some people have rebreathers. That's the ball ones. I didn't opt for that. I have in here pretty simple stuff. I just have the, first of all, the nasal, the trumpets. I have a set of those, 28Fs, 32F, and I think 26. And then I have the CPR mask, and then some Berman airways. Okay, got to know how to use them, Berman airways. It's a little different than snaking a tube down your nose and call me in 15 minutes. If you've ever seen Caddyshack, that's my best rendition of that, and I probably failed miserably. But at any rate, also with the Bermans, to install it, there's one of 2 ways to do it. You can come, once you've opened and moved, you can come from the top down or from the bottom. If you come from the bottom, you'll need some tongue suppressors, and those are also in here. Okay, moving on to, now this is kind of an ouch pouchy type thing. And it says ouch pouch. Let's go into that. What I have here, triangular bandages, slings, things like that. Large ab pad, something to cover up a nasty ab wound. Rather than that stuff, if you have ever seen any kind of wounds that have any exposed intestines, just get them covered, because what it does is if the customer, like they signed up for that, right? If the patient sees it or anybody else around there sees it, he just get it covered. Keeps everything off of it, keeps it clean for later when they get to their second level of treatment. Okay, this opened up. This is, what is this? Oh yeah, this is a Dark Angel ouch pouch, okay? This is for the cuts, stings, bruises, stuff that's not that important. Medications, unit doses, all right? Just a bag of those. Acetaminophen, upset stomach, things like that. 2 triangular bandages, 4 slings, etc., etc. And then probably something that I don't need in here. Oh yeah, I also do have some, I guess you'd need to see that, wouldn't you? I do have a petroleum gauze in there, or petroleum gauze for your proper English people. And that would help with blisters and things like that. And then kind of a luxury, I don't know, it's a quick seal wound care spray, just to stop some bleeding. And that's it. Okay. And, and here's the case of me having something. You'll notice in here, everything in here I can use and have trained with and can use. Now I'm going to pull something out here that I've never used. Okay, this is a needle D, 14 gauge chest decompression needle. And do I know how to use it? Yeah, I know how to use it. I mean, I've been shown. I've actually, well, I can't say I've never been trained. I've stuck a dummy with one, but I've never actually had to really use it. So if you don't know how to use one of these things and there is EMS on the way, don't start trying to treat a tension pneumothorax, because they potentially do more harm than good. I'm using up a bunch of air and oxygen saying that these look cool in a bag, so I have 2 of them. There you go. All right, I bought them. I might as well stick them in there. You know what, guys? I think that, and ladies, assuming a few of you are looking, that pretty much wraps it up here. Now, again, what's the takeaway point? Get some training from an accredited instructor. There are plenty of classes out there, and it will do worlds for your confidence if you do this. Okay, do that. All right, we'll wrap this up with a little bit more philosophy of what and whys in a second. Let me change the camera angle back. All right, hold everything, time out. I almost forgot something. Now I know that somebody out there is going, yeah, but you didn't include. I got you covered. Here we have one secret compartment. Zips. What's in it, you ask? First thing, well, in case you shake hands with a suppressor, and I've done that, burn kit. Okay, what's in it? Just gels, a couple of dressings, and things like that. So I do have a burn kit for that. And second thing I have in here are, well, here's another, this is a tack wrap. This says a dressing and cravat, but a dry multi-purpose burn. I guess, I've never actually opened this, but you can use it as a triangular bandage, or you can use it as a coverall for burns. And then we have a couple of the actually 3 rolls of self-adhering tape, and that is for our splint in case Glitter Team Lead sprains his ankle because he didn't lace up his Rothko jungle boots quite tight enough. You got him covered. So anyway, that is it actually. Let me put all this back together and then we'll walk you out of this video. All right, wrapping this block of time up. I appreciate you staying with me. I hope you've learned a few things. We'll close out with a few personal points as to why I would have a medical kit out here like this of this size. 3 things. The first injury that I'm most likely to encounter out here are farm injuries. Chainsaws, tractors, log splitters. Those tend to be pretty nasty when they happen, so I need to be equipped to treat that because I am 30, if not 40 minutes away from any kind of EMS help. The second thing that I would likely see out here is me, I keep it in my car kit, accidents. Okay, I have to travel. I'm 45 minutes away from any Walmart, any kind of town at all, so I have to travel. This does go with me. I keep it in my truck, so it's always with me. If I see any accidents and if I can lend any assistance, I will. Third down the list of likelihood is gunshot wounds. Yeah, I guess it could happen, but not in the sense that somebody's gonna be trying to poke holes in me. More likely to have a ricochet off of steel or a negligent discharge or, well, God forbid this would happen, somebody on my range that doesn't know how to handle a firearm, which I'm pretty thorough about checking people out. But anyway, those are the 3 things that in that order are most likely to be encountered by me. And that's why I have this big bag. Plus it looks cool, so, you know, and I know you guys do a lot of stuff on looking cool, right? Hey, next time, God knows what I'll be covering, but I do appreciate you making it this far. Like and subscribe. Give me a few comments on what you carry and why, and we'll see you in the next one.